Hello, everyone. It's so nice to see you all virtually. My name is Jessica Goldblum, and I'm the chair of the Graduate Student Symposium titled Masks, Mandates, and Mourning Individuals with Neurodevelopmental and Genetic Disorders and Their Families During the Time of the COVID-19 Global Pandemic. So I'm going to go ahead and do some introductions, first of myself and then the other two grad students, followed by our discussant. So first I'll introduce myself. I'm a third year doctoral student in developmental psychology at UNC Chapel Hill, and I'm a current candidate for a Master of Arts degree in psychology. I'm a graduate student researcher across two labs, the Harrop Lab, run by Dr. Claire Harrop in the Department of Allied Health Sciences at UNC, and the Brain and Early Experience Lab, run by Dr. Kathy Proper at the Frank Porter Graham Child Development Institute. My research examines the early development of social communication in autism and typical development, and with a specific emphasis on biobehavioral measurements such as eye tracking. I'm also particularly interested in the influence of poverty, SES, and financial related stressors on the development of early childhood social communication and interaction. In my 3 years at UNC, I've been fortunate to receive a UNC Translational and Clinical Sciences Institute grant for my research, specifically a pilot study testing a novel eye tracking paradigm designed to examine joint attention in young children remotely. And today I'll be presenting on my paper entitled The Hardest of Times, Child Behavioral Characteristics in Autism, Parent Distress, and Financial Strain in the Time of COVID-19. So after my presentation, we'll see Carly Hyde and her paper entitled The Impact of COVID-19 Restrictions on Individuals with Intellectual and Developmental Disorders, the Caring Through COVID Survey. Carly Hyde is a current candidate for a Master of Science degree in Public Health at UCLA, as well as a project coordinator and grad student researcher in Dr. Shefali Jesti's lab at the UCLA Center for Autism Research and Treatment. In her 4 years at UCLA, Carly has worked with patients, families, and advocacy groups across many rare genetic syndromes, including tuberous sclerosis complex, Dup15q syndrome, and Angelman syndrome. Much of her research aims to improve the ability of under-resourced families with complex medical and behavioral needs to access high-quality therapies and clinical care, often by leveraging remote delivery options. She also aims to improve the representation of geographically and racially diverse participants in research, a critical step towards improving care in the community. And our third grad student today is Alan Gerber. He'll be presenting his paper entitled Social Interaction and Psychosocial Well-Being in Youth with and Without ASD During Mandated Quarantine. Alan is a fifth-year PhD student in clinical psychology at Stonybrook University, studying under Dr. Matthew Lerner. He also treats clients and families of all ages through the Krasner Outpatient Clinic. He earned his BA in psychology at the University of Maryland and an MA in psychology at Hunter College. He's completing his doctoral dissertation examining social isolation and loneliness in youth with and without autism spectrum disorders during the course of COVID-19 induced quarantine. His research interests also include identifying predictors of variability in treatment outcomes in order to maximize patient benefit through individualizing interventions. And finally, I'm delighted to introduce our discussant. Our discussant is Dr. Brian Boyd, an associate professor of applied behavioral science at the University of Kansas. He is director of the Juniper Gardens Children's Project at the KU Lifespan Institute. Prior, Dr. Boyd was an associate professor of occupational science and associate chair for research of the Department of Allied Health Sciences at UNC Chapel Hill. He has been the principal or co-investigator of several grants funded by the National Institutes of Health and Institute of Education Sciences to develop and evaluate outcome measures, as well as focused intervention practices and comprehensive treatment models for young children with autism. Dr. Boyd's research areas included restricted and repetitive behaviors in autism, development and evaluation of behavioral interventions, identifying and disseminating evidence-based practices for young children with ASD, and community-based research. Dr. Boyd is co-editor of the Journal of Early Intervention, and Dr. Boyd's research has been published in journals such as Autism Research and Journal of Autism and Developmental Disorders. Dr. Boyd has served as an executive member of the Gatlinburg Conference since 2009. We are delighted to have Dr. Brian Boyd as our symposium discussant. So now, without further ado, here are our graduate student presentations. Hello, everyone. Again, my name is Jessie Goldblum, and I'll be presenting on my paper entitled The Hardest of Times, Child Behavioral Characteristics and Autism, Parent Distress, and Financial Strain in the Time of COVID-19. On March 11th, 2020, the COVID-19 crisis was declared a global pandemic by the World Health Organization, and normal life was upended. In addition to core features of the disorder, autism spectrum disorder is characterized by difficulties with self-regulation as well as behavioral inflexibility, or BI. BI is characterized as rigid or inflexible patterns of behavior that contrast with the need to be adaptable to change. ASD individuals and their families often rely on daily routines to reduce anxiety in ASD and to help plan for uncertain times. The time of COVID-19 is filled with uncontrollable changes, which may exacerbate difficulties with flexibility and self-regulation seen in autism. In addition, caregivers of ASD children have been faced with exceptional challenges during this year. With schools and treatment programs and other support systems shut down, many parents have had to assume the additional roles of full-time caregiver, teacher, and therapist during 2020. Moreover, online schooling and support systems that families do receive during COVID may not be suitable replacements for their autistic children, which requires further parent intervention throughout the day. And this is particularly concerning because the pandemic has caused a large number of US families an additional source of worry: financial strain. By May of 2020, a staggering 20.5 million Americans filed for unemployment, with women, minority groups, immigrants, and citizens without a college education hit the hardest. And again, the autism community seems to have been particularly affected by financial strain. A small bit of research has currently been done that looks at financial strain and caregivers of children with neurodevelopmental disorders. And parents are reporting that many do have financial problems as a result of COVID, and some are also expressing concern about stability of their living situations. So this is an incredibly tough time for families. Additionally, we know that financial strain and SES-related stress impacts the parent-child relationship. And this may be especially true during the COVID-19 pandemic, when kids can't get services due to the virus or financial concerns. And we already know that parents of ASD children are really stressed just in general. Outside of the pandemic, parents of ASD children are on average more likely to report higher distress levels compared to parents of neurotypical peers. So we know that distress levels of caregivers of ASD children are likely to have been exceptionally compounded during COVID-19 with financial strain, all of these additional stressors. ASD children might also be particularly impacted during this time, facing additional difficulties with an unprecedented pandemic. And we know that parent-child interaction quality may suffer during COVID-19 because of all of this compounded stress. So in order to understand how best to improve the quality of life of the ASD community during times of crises, research is needed to examine the relationship between ASD behavioral characteristics in childhood, parent distress, and parent-child interaction quality, as well as financial stress during COVID-19. So the current study had three aims. First, we aim to characterize financial strain experienced by families of ASD children during COVID-19 and how this financial strain contributed to parent distress. Second, we aim to understand how ASD child behavioral inflexibility and self regulation affected the relationship between financial strain and overall parent distress during COVID 19. And third, we sought to understand whether parent distress significantly predicted parent child dysfunctional interactions during COVID 19. So, participants for this study were recruited from the UNC and OSU sites of Project BID for behavioral inflexibility in developmental disorders. And to the right of this slide, you can see the Project BID investigators. And so children were 3 to 19 years of age. Average age was about 9.5 or 9.5. And the study included 40 children with autism and 19 neurotypical or typically developing children with a total sample size of 59 children and their caregivers. And with this study, parents completed a battery of online surveys through UNC Qualtrics. Parents completed the Parenting Stress Index short form, and this is how we got how we captured global measures of parent distress, measures of parent-child dysfunctional interactions, as well as parent-reported measures of self-regulation. Parents completed the Behavioral Inflexibility Scale, which is a parent report measure of behavioral inflexibility behaviors occurring daily across home, school, and community environments. And parents also completed a financial strain questionnaire. So descriptive statistics were used to examine financial strain in our study families. However, due to our small sample size, we were not able to test for differences in financial strain between ASD and typically developing groups. Additionally, for ASD families, stepwise regression was used to examine the relative contributions of financial strain, child behavioral inflexibility scores, and child self-regulation scores on parent distress. And simple linear regression was used to examine the relationship between global parent distress during COVID-19 and parent-child dysfunctional interactions. All study analyses were conducted in R, and all present standardized estimates of beta coefficients. So of our 59 participants, most had families who were affected financially by the pandemic. 1/3 had parents who took a cut in salary, and 15%, or 9 children out of 59, had parents who were laid off or furloughed during the pandemic, which is a pretty large amount for such a small sample. 37% of families had to postpone medical or dental care to save money during COVID, and 39% of families had reduced or eliminated medical insurance due to financial reasons. Typically developing and ASD groups did not significantly differ in financial stress levels, but we did find that ASD children had significantly higher levels of behavioral inflexibility compared to typically developing peers, and they also had poor self-regulatory abilities. We ran stepwise regression analyses using Bonferroni adjusted alpha levels of 0.1 per test. So first, having a child with an autism diagnosis alone did not significantly predict parent distress during the pandemic. So because of this and our small sample size, we dropped typically developing cases from subsequent regression analyses. Next, financial strain was regressed upon global scores of parent distress, and financial strain was found to be an insignificant predictor of parent distress. Subsequently, we completed model 2. We added behavioral inflexibility. And in this model, neither financial strain nor behavioral inflexibility predicted parent distress scores. However, in our third model, where we added in child scores of self-regulation, we find that financial strain and self-regulation scores were both strong, robust predictors of parent distress during the COVID-19 pandemic. And finally, using simple linear regression, we examined parent-child dysfunctional interactions during the pandemic and global levels of parent distress. And we found that parent distress was a strong, significant predictor of parent-child dysfunctional interactions during COVID-19. So this really tells us that the COVID-19 pandemic has affected parent-child relationships, especially with all of the stress that families are experiencing.
Overall, it seems that the ASD community seems to have been affected by the pandemic, both financially and emotionally, with stress levels very, very high. Not surprisingly, financial stress was a significant predictor of parental distress. However, after accounting for behavioral inflexibility coupled with financial stress, child self regulation, or parent ratings of child self regulation, was the most robust predictor of parent distress. This suggests that financially stressed parents who rated their child as having poor self regulation had significantly more distress, and subsequently, more distressed parents were seen to have more dysfunctional parent child interactions during the COVID-19 pandemic.
And so for limitations, there were several for this study. We were unable to account for race or ethnicity, as well as biological sex or gender in our study analyses because our sample size was small, but future research should examine how race or how all of these study variables may impact the relationship between financial strain and parent distress. Additionally, our sample size and age range were limited, so we were only able to look at children aged 3 to 19 with autism. And so future research should look at children who are the youngest children who are diagnosed with autism, which can be reliably diagnosed at 18 months, as well as young adults and adults with autism. We were also only able to look at a single time point for this study. The study was conducted from May to through July of 2020. So this was really early on in the pandemic. And we don't really know how this data would look now with stages of reopening, stimulus checks, access to vaccines, and now access to services after all of this. So we see that children are kind of switching between virtual and in-person school, and so future research to look at multiple time points within crises. And again, future directions, there should be more research on telehealth interventions, particularly those that target self-regulation and behavioral inflexibility in times of crisis. And research should look at short-term and remote telehealth interventions. So how can we reach children remotely for maybe a month or two to really focus on strategies to improve self-regulation? And we also want to know, how are ASD adults coping during this crisis? So thank you so much for this wonderful opportunity to chair the Gatlinburg Graduate Student Symposium. I want to especially thank the other grad students who are a part of the symposium, Carly and Alan, as well as Dr. Brian Boyd, our discussant. I'd like to thank my mentor, Dr. Claire Harrop. And I'd also like to thank Project BID study families. We could not have done all of this research without you. And thank you so much.
Today, I'll be presenting data from a large national survey of families of individuals with genetic disorders associated with neurodevelopmental disabilities. The UCLA Caring Clinic is a multidisciplinary clinic for individuals with neurodevelopmental disorders associated with genetic syndromes, which I'll call genetic NDDs. Many of these children experience medical complexities as well as profound developmental delay, treated primarily through access to behavioral and therapeutic services. To better understand the specific needs and impacts of individuals with genetic NDDs through the current pandemic, we partnered with several national patient advocacy groups to conduct the Caring Through COVID survey in April 2020 and again in February of 2021. This online survey had 3 aims. First, we wanted to evaluate what services children with genetic NDDs were accessing through COVID and better understand the challenges and successes. Second, we wanted to evaluate the impact of COVID-19 on children and parents, including their overall well-being, positive and negative experiences, and behavioral symptoms for children. Finally, our third aim was to understand the interaction between the services that children were receiving during COVID, as well as their overall well-being. Participants in the survey were parents of children with a genetic NDD, meaning both a genetic diagnosis and a diagnosis of either developmental delay, intellectual delay, autism spectrum disorder, or epilepsy. We sent the survey through patient advocacy groups, and over 1,100 parents participated. I'll use the 668 complete surveys from families within the US in my analysis today. The second survey was sent through the same patient advocacy groups, though the participants are not necessarily the same, so we'll consider this a second cross-sectional sample. I'll reference the second survey towards the end of my presentation today. Briefly, this data represents individuals from 46 states. 14% of the reports came from parents of infants and toddlers, and about 18% of the individuals represented have children who are older than 22 years of age. We asked about communication and mobility in our second survey and found that over 20% of the individuals had a child who is minimally verbal, and a 20% of those individuals have a child who uses single phrases. And about 15% of the individuals in the survey have a child who uses a wheelchair. The completed results from AIM 1 were published in fall of this year, but I'll summarize that in the early months of the pandemic, 78% of individuals lost access to at least one of their educational or therapeutic services, such as physical therapy, occupational therapy, or recreational therapy. 30% of all parents reported that their child lost access to all of their services. However, 56% of parents reported that at least one of their child's services had shifted to remote delivery. When remote delivery was available, the majority of parents rated these options as at least a little bit helpful, and only 10% rated their telehealth services as not at all helpful. We also asked parents some open-ended questions about what modifications would improve their experience overall. The main themes are shown here in order of response frequency. Many parents reported that the primary challenge for their family was that their child was no longer receiving some of the needed therapies in any capacity, and they would prefer any type of remote delivery to no delivery at all. Of course, some parents also wanted to return to in-person services, and some parents also expressed needing more support and less demand on their time. I'll take an aside here to note that age is a critical factor in the number of services received both before and during COVID, and that's a theme that we'll see throughout my presentation. Individuals who are over 22 years receive far fewer services than individuals who are school age, both before and during COVID. Age confounds nearly all of the variables that I'll talk about today, so I'll control for age throughout the presentation. Moving to AIM 2, we wanted to assess the impact that COVID had on children with genetic NDDs by asking parents whether their children had experienced an increase or worsening in any of the specified behaviors or symptoms. Sleep disruption and anxiety were the most commonly reported, followed by mood dysregulation. Overall, nearly 80% reported a worsening of at least one symptom, and the average was 3 symptoms. We also asked parents to report on their experiences and found that anxiety and frustration were the most commonly endorsed. However, 75% of parents also endorsed at least one positive experience, such as increased closeness with their family. Our third aim was to understand whether there was an interaction between the services a family received during COVID and their well-being. While there's a ton of variation in this data set, overall, I found that the number of services that a child lost, as well as the quality of those services, as indicated by the parents' report of the helpfulness of the teleeducation, predicted the number of worsened symptoms for a child at a p-value of 0.01 and an R-square value of 0.31, meaning that while this relationship is significant, there's definitely some variation not captured by the survey. However, geographic region and the specific developmental diagnosis and the financial impact of COVID were not significant in this model. In other words, the quantity and the quality of remote therapies makes a difference in how well a child is doing according to their parents. To summarize, we found that most individuals with genetic NDD lost access to at least one therapeutic or educational service, but most also received at least one teleeducation replacement. Overall, these replacements were helpful to parents, though at the time of the survey last April, there were certainly many suggestions for improvement. We also found that many parents reported worsening in their child's behavioral symptoms, and parents reported a lot of negative experiences themselves, though most also had a positive aspect to report. Finally, I found that the number of services lost and the quality of teleeducation correlated with the number of worsened symptoms for children with genetic NDDs. Now, coming back to the data collected last month, we do see that families have more access to in-person services in the second survey than the parents who completed the survey in April of last year. So the number of services lost overall is lower, and that's good news. However, we also asked parents in the second survey how their access to services has changed since the beginning of the pandemic, and an astounding 40% say that their services have gotten worse in the last year, though over half say that their services have gotten better or stayed the same. We also asked how access to services has changed since November of 2019, so before the pandemic. Interestingly, 18% of parents, so in this second sample, which is about only 100 participants, that's 18 parents, but 18 parents said that their services had actually improved compared to pre-COVID. So looking at the qualitative reports for these families, it seems like a lot of these individuals and parents switched their children to new providers who offered telehealth and actually preferred their new providers. Others say that they now have some additional supports that they hadn't had previously. So there are many conclusions that we can take from this data. First, there's a wide range in the number and quality of services that individuals were receiving prior to COVID, which makes it difficult to directly assess the impact of losing access to such therapies. Second, the number of services is important to well-being, but of course, so is the quality. It'll be important to find and enhance what has worked, while noting that not everything should be done remotely. Third, we certainly know that individuals with intellectual and developmental disabilities grow up, and so do their parents. Their needs don't end at age 22, but their access to support suddenly becomes quite a bit more limited. As we think about the future role of telehealth, we may want to consider how increased accessibility could benefit those who are vastly underserved, including adults. Which brings us to the final conclusion. What is the future of teleeducation? It's unreasonable to put the entire burden of therapy and education on parents, but it also may be a good fit for some families, particularly those who work during the day but want to be involved in their child's care, are geographically isolated, or whose child have a medical limitation. For these families, high-quality remote options should remain available, and we should continue to enhance the infrastructure to improve the quality of delivery for those who want it. I'll end with a quote published in a letter to the editor last year. Among non-infected persons in the United States, few are more adversely affected by COVID-19 than individuals with intellectual and developmental disabilities, given that a vast proportion require in-person care or critical therapeutic services within their living environment, with little backup or systematic coverage for prolonged interruption of such support. Many people had an intuitive hunch about the impact that COVID had on individuals with genetic NDD, but it was important to quantify and monitor these changes over the past year. This data can help us as we selectively reduce, expand, and improve telehealth over the coming months and years. And with that, I would like to thank all of the families who completed the survey and the Geste Lab and Shefali Geste for her support during this project, as well as all of the patient advocacy groups who completed and helped disseminate the data that we have here today. Thank you.
Hi everyone, my name is Alan Gerber and I'd like to welcome you to my talk. Today I'll be speaking about social interaction and psychosocial well-being in youth with and without ASD during mandatory quarantine. Autism spectrum disorder, or ASD, is defined by difficulties in social communication and interaction, such as making eye contact or having a back and forth conversation. Likely as a result of these social difficulties, youth with ASD experience a reduction in the quantity and the quality of their friendships relative to their peers without ASD. Research also indicates that youth with ASD consistently report higher rates of loneliness than their peers without ASD. Further, internalizing symptoms such as anxiety and depression are especially common among youth with ASD. Parents of youth with ASD already experienced high levels of parenting stress pre-pandemic as well. Social isolation and loneliness already represented significant public health concerns. Social distancing and quarantine can exacerbate these existing vulnerabilities in youth with ASD, leading to increases in things like loneliness and internalizing symptoms. And indeed, early research is beginning to show high levels of parenting stress, increased behavioral challenges, and disruption of services for youth with ASD since the spread of COVID-19. So, the current study examines how quarantine and social distancing impacts the psychosocial well-being of youth with ASD and their families. Participants in the study included 76 youth, ages 8 through 17, with an average age around 12. So we only recruited participants who had previously participated in a study in our lab. Therefore, all participants had already completed an ADOS-2 and cognitive testing with an IQ above 70. ASD status for this study was determined via the ADOS-2. Data for this study was collected in June of 2020. And at that point, parents completed measures of their child's current ASD symptom severity, as well as internalizing symptoms. Parents also reported on their child's daily activities through the SII, which is a measure that we developed specifically for this study. So the SII included questions about how much time their child spent on activities, so things like video chatting and messaging. Items were rated on a 1 to 5 Likert scale from no time to more than 6 hours per day. Parents were asked to report on their child's current activity, as well as to retrospectively report on what their child was doing in early March before the spread of COVID-19 in the US. They also completed a measure of their own parenting stress. Youth with ASD completed self-report measures of their internalizing symptoms, as well as their loneliness. So what you're seeing here on the x-axis is parent report of current ASD symptom severity in June. And on the y-axis, you're seeing parent-reported anxiety in their child. And so what you can see is the significant relationship where ASD symptom severity was associated with higher levels of parent-reported anxiety in their child. Similarly here, the x-axis is the same, but now you're seeing parent-reported depression on the y-axis instead of anxiety. And you're seeing, again, a similar relationship where higher levels of current ASD symptom severity were related to higher levels of parent report of depression in their child. So similarly here, x-axis is the same, but now you're seeing the child report of depression, and you're seeing a similar significant relationship where greater ASD symptom severity was associated with greater self-reported symptoms of depression. And it was also marginally associated with greater self-reported loneliness. Now here, same x-axis. On the y-axis, we're now looking at parenting stress related to family problems. And so you can see a pretty significant relationship here between higher ASD symptom severity is related to higher levels of parenting stress due to family problems. And similarly, higher ASD symptom severity was significantly related to higher levels of a pessimistic attitude towards towards parenting in parents. So let's take a look at the data on social activities for youth with ASD. Now this is parent report here of talking on the phone to friends. So what you can see on the x-axis, and the x-axis will stay the same throughout the rest of these graphs, you can see the time that data is reflecting. So remember, at baseline, we asked parents to provide both current and retrospective reports of their child activity. So here you're seeing the retrospective report in March and the baseline in June. On the y-axis, you're seeing time spent on the phone talking to friends according to parent report. And so remember, this is a 1 to 5 Likert scale. Higher scores mean more time on the activity, and that's going to stay the same through the rest of the graphs. So finally, you can see in the red, you're seeing youth without ASD, and in the greenish, you're seeing youth with ASD. So first of all, there was a significant main effect of ASD group, and that indicates that youth with ASD spent less time talking on the phone than youth without ASD, according to parent report, and that's across time, right? But you're also seeing a main effect of time here, which indicates that across groups, both kids with and without ASD increased the amount of time they spent talking on the phone to friends from March to June. And finally, you're seeing a marginally significant interaction between group and time. And this suggests that on average, youth without ASD showed greater increases in their time spent talking to friends compared to youth with ASD, according to parent report. So here, x-axis is the same, the colors are the same, but now on the y, you're seeing parent reported time spent that their child spent on interactive video games. So here, there was a significant main effect of ASD group, and that indicates that youth with ASD spent less time overall across time playing interactive video games according to parent report. And in addition, there was a significant main effect of time. So across groups, both groups of kids were increasing the amount of time they spent on interactive video games from March to June. The interaction between group and time here was not significant. So here, again, x-axis is the same, coloring is the same. On the y, you're now seeing the time spent video chatting with friends, according to parent report. And so there is a significant main effect, again, of group, and that indicates here that across time, on average, youth with ASD spent less time video chatting with friends, according to parent report, than youth without ASD, right? There's also here a main effect of time. So again, across groups, you're seeing that both youth with and without ASD increased the amount of time they spent video chatting with friends from March to June. And the interaction here between group and time was, again, not significant. So finally, same x-axis, same coloring. On the y, you're now seeing time spent messaging with friends. And what you can see here is a significant main effect of group. Basically, youth with ASD spent less time messaging with friends, according to parent report. And there was no main effect of time and no significant interaction. So our findings here demonstrate that both youth with and without ASD increased their time spent interacting with friends through key social outlets. Nonetheless, Youth with ASD still lag behind their peers considerably, with the gap widening in one key social outlet. So underscoring the importance of these social difficulties, higher current symptoms of ASD were associated with greater risk for internalizing symptoms, loneliness, and higher levels of parenting stress. Current symptoms of ASD were associated with greater loneliness and internalizing symptoms in youth. Given the massive disruptions in youth and services for youth with ASD during COVID, our results suggest the need to develop and proliferate targeted teletherapeutic interventions for youth with ASD. And in addition, current symptoms of ASD were associated with higher levels of parenting stress and pessimistic attitudes, according to the parent report. Parents of youth with ASD consistently reported high levels of parenting stress before the pandemic, and that's been linked to internalizing symptoms in their children. Therefore, it's really important to consider the needs and the mental health of parents of youth with ASD when you're treating their children. These results also reveal lags in adaptive social behavior in those with ASD during this critical period. So although both youth with ASD and without increased their digital social activity from March to June, youth with ASD still lagged behind their peers considerably, and the gap widened in at least one key social outlet. And so one possibility for this gap in adaptive social behavior could be challenges with cognitive flexibility, typically experienced by youth with ASD, and that could lead to real difficulties adjusting to a social life in the pandemic. Alternatively, it could be that youth with ASD have difficulty replacing those in-person social connections with digital interactions. Future research should investigate how this gap unfolds longitudinally over the course of the pandemic and whether these gaps in adaptive social behavior lead to increases in loneliness and internalizing symptoms over time in youth with ASD. So I just want to quickly thank my co-authors as well as the whole team in my lab and I want to acknowledge all the participating families in the study. And thank you so much for listening.
Hello, I'm Brian Boyd from the University of Kansas, and I'm so pleased to be a discussant for this panel. And I think I first want to emphasize to the listeners out there that this is a graduate student symposium panel. And I'm just so pleased to see this tradition continue at Gatlinburg, that we continue to provide an opportunity and a space for graduate students to present the wonderful work they're doing. I first attended Gatlinburg many years ago now as a doctoral student, and have remained a loyal attendee ever since then. So I'm so grateful to be a discussant for this panel and to have heard such wonderful presentations from these students. So I just want to share a few of my insights, some general take-home points, but also pose some questions for us all to consider, given the three presentations that we've heard from this group. I think the first thing that we know and have seen repeatedly is that this pandemic has exposed and exacerbated divides in our society. I mean, really, we see that more marginalized and vulnerable groups have been more impacted by the virus. This plays out in racial ethnic disproportionality in COVID deaths and hospitalizations. It plays out in that some communities have been more financially impacted by the pandemic than others. We also know that as schools have shifted to remote learning, that some students have been more impacted by others, including students with disabilities who may be having more trouble with virtual learning or learning in a virtual space. The other thing is that because this is a virus and a pandemic, we often talk about and consider the physical health implications, but we don't talk enough about the mental health implications. And these papers really forefront that both parents and children with disabilities are also experiencing or being affected. Their mental wellness, the mental health is being affected by the pandemic as well. So I just want to point out sort of some things about the three studies. And I think Jessica's study really reminded us that parents of children with autism, as we know, are at increased stress, an increased level of stress, right? We see this in comparison to students with other kinds of disabilities, parents of kids with other kinds of disabilities, as well as parents of kids who are typically developing, that parents of children with autism tend to have higher levels of stress. And there were a couple of stressors in this study. One, the child's ability to self-regulate, which it's understandable why children with autism may be having trouble with self-regulation during this time, but also the financial strain of parents. And it made me think, should we be considering interventions differently during this time? There used to be an approach we talked about within the context of working with vulnerable populations of wraparound service delivery, that we're not going to just intervene at the level of the child, but also think about what support systems the family may need. And so do families who are being really financially impacted right now also need access to social welfare benefits to help take care of the family unit, so that they then have the space, the mental space to be able to take care of their child. I think Carly's study reminded us that certainly families with children with all kinds of disabilities are being impacted by this pandemic, by COVID, but families of autistic children may be experiencing or seem to be experiencing increased vulnerabilities. And while that study showed that certainly we're seeing increased symptom severity in some cases, increased challenging behaviors amongst children with autism, we're also seeing, though, that there may be some protective or positive symptoms that are coming out of this. And I think it's important to focus on that as well, that it's not all negative, it's not all bad, that there may be some areas where there are protective factors. So, families said that they felt more close to their family during this time, right? There's a sense of closeness and connection. Also, protective factors was if the family was satisfied with the telehealth services that their child was receiving, that was helpful during this time. Also, obviously, the child not having as many challenging behaviors, or essentially being able to better cope with what is happening right now in society, was also a protective factor. So yes, families of children with autism, families of children with intellectual disabilities or developmental delays are certainly experiencing challenges, but there also may be some opportunities to think about protective factors and positive outlook of what is happening right now in society. And then Alan's study is so important as well, because it reminds us that we also need to think about the actual experiences of autistic youth. What's happening with them, right? And we know from his study and from others that their mental health is being impacted. We're all feeling issues of isolation and loneliness right now. And certainly youth with autism are also experiencing those things. And even more so, it seems, in their typically developing peers. And so how do we keep autistic youth socially connected as we all move into this virtual space? That's something we need to think about and consider. So I appreciate really have an opportunity to be a discussant for these three wonderful presentations. The findings were very interesting and relevant, but they also pose some very important questions for us to consider moving forward. So thank you for taking the time to listen to this panel, and take care.